CBS Radio News correspondent Bill Rehkopf joins me now by phone. Bill, what do you make of these numbers coming out?
Well, the numbers are very similar to the House version, give or take, except for the estimated reduction to the deficit, which of course is being accounted for by reductions in Medicaid spending. But when you think about it, 22 million more people would be uninsured by 2026 to a total of 49 million Americans uninsured by 2026. That compares to 51 million Americans under the House bill. And again, so, you know, not a lot of differences in the terms of people who are being uninsured, but the difference will be in the cost savings from the Medicaid rollbacks.
What are you hearing from Republicans on Capitol Hill about this?
Well, we just got a statement in from the Democratic Senatorial Campaign Committee, and they say that you know, the Republican plan will make working people pay more for less care, and they say, like the House plan, the Senate proposal would spike costs and strip coverage just in an effort to give big insurance and the wealthy another tax break. So it's the same line that we've been hearing from Democrats. Chuck Schumer, the Senate Minority Leader, and other Senate Democrats are going to have a news conference here probably in the next 10 minutes where we're expected to hear more of the same.
When you talk about Republicans, Bill, who some of them on the fence, some of them haven't come forward, we know at least 5 over the weekend had said that they're not happy with this. Do you see consensus growing in that this isn't something they want to support? What are you hearing on that front?
Well, the 5 who are sitting on, who have come down on the no side, have come down because that this is not a total repeal of Obamacare. So you've got the Rand Pauls, Ted Cruz's, Ron Johnson's, Mike Lee of the world. Those are the folks, those are the 4 who came down and said, you know, we didn't run on Obamacare light, and they want to see further cuts. So, you know, I'm not sure how much the score helps or hurts what they're thinking about. Dean Heller, the Nevada senator who said he couldn't vote for it the way it is now, thinks it cuts too much. So certainly he's not going to be swayed by the CBO report. Then you've got moderates on the other side. And we were talking about Susan Collins of Maine and Alaska's Lisa Murkowski. They don't particularly care for the bill because of the Planned Parenthood cut in the first year, and there are other concerns as well. And we just heard from Senator John McCain, who we just said, you know, he doesn't like the way it looks. He says it's going in the wrong direction, and on top of that, he says he doesn't like the process. He says this thing should have been vetted out. It should have gone through hearings, should have gone through the normal legislative process in an effort to slow this thing down.
Any reaction from the White House, Bill?
Nothing yet. As a matter of fact, the president getting ready to have a short statement with the Indian prime minister, but interestingly enough, he's not going to take questions. Now, one thing I would expect him to talk about, he's going to come out, and I'm sure he's going to have plenty to say about the Supreme Court ruling a little bit earlier today on his travel ban, but he may have something to say as well. The problem is reporters won't get a chance to bounce any questions about it.
You look at this decrease in the federal budget, the federal deficit, $321 billion over a decade. It's larger than the $119 that was proposed in the House bill. Is that something that Republicans could rally around?
Potentially, but, you know, at what cost? Again, we're talking about the rollback of Medicaid, and, you know, there's a lot of people who aren't really happy with the idea that people are going to lose access to Medicaid because, you know, many of the constituents of some of these Republicans are saying, look, it's not just, you know, poor people who are using Medicaid. Middle-class families increasingly use Medicaid for special needs kids, things of that nature. So where they're getting the savings in this CBO score is coming from an area that, you know, many of the middle-class constituents are telling their lawmakers, no way.
So what happens next, Bill, with this bill on Capitol Hill in the Senate?
Well, that's the big question, isn't it? Because, you know, the bottom line is they wanted to see something rolled out this fall, this week. And there was a thought that they could get it done before lawmakers leave town for the July recess. But there's a growing sentiment on Capitol Hill that this bill is a mess right now, and they need to slow it down like they did in the House, take it off the table, go behind closed doors, have some meetings, see what they can come up with, and then maybe try to bring this thing out again to see if it's something that they can get the necessary votes. Remember, you know, Mitch McConnell has just a razor-thin margin. He can only lose 2 Republican votes on this. Right now, many, many more have either said no or are on the fence or just completely undecided.
So bottom line, Bill, do you think the CBO score helps or hurts the cause in getting this through the Senate?
I think for Mitch McConnell, I think it's another Excedrin on the head that he's going to have to pop for the headache.
All right, Bill Rehkopf, thank you very much for joining us.
Thank you.